women who are not breastfeeding, the sight of any discharge from the nipples can be actually very scary. But please don't panic. While the nipple discharge can be serious in some cases, in most cases it is either normal or due to some minor condition. So hello everyone, this is Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. We talk about periods, contraception, safe sex, vaginal health, PCOS, pregnancy, menopause, breast health, and a lot more. So stay tuned, there's a lot for every woman out here. And if you find today's information useful, do not forget to like, share, and subscribe to Maitri. So what are the reasons of nipple discharge? The discharge from the breast or the nipples could be either a milk discharge or a non-milk discharge. So let's first talk about the milk discharge from the breast. The first is obviously pregnancy or breastfeeding. It is normal for some milk to leak out of your nipple when you're pregnant or lactating, and even up to 1 year after you've stopped breastfeeding, the milk could leak out from the breast. Nothing is to be done for this. But sometimes, even if you are not pregnant or even breastfeeding, the breast could contain milk and it could leak from the nipple. Now, this is known as galactorrhea. Now, this is a little complicated name. This isn't a disease, but it could be a sign of some underlying problem. It can occur in women, even those who have never had children, or even after menopause, it can happen in men too. So to understand it a little better, let's understand how is milk produced in the body. The milk is produced in the breast during pregnancy and breastfeeding because of a complex interplay of many hormones. Some which prime the breast, estrogen and progesterone. Some which make the breast produce milk, Prolactin, and finally a hormone which causes the milk to be released from the breast, that's called oxytocin. The main reason for the milk discharge from the breast is high levels of a hormone called Prolactin. It is a hormone which is released from the pituitary gland in the brain. Now, this condition where the prolactin levels are very high is known as hyperprolactinemia. The high levels of prolactin could be either normal or sometimes pathological, which means sign of some disease. So, the galactorrhea, the milky discharge from the breast when a woman is not really pregnant, could happen because of many reasons. Number 1, excessive breast stimulation, especially sucking. Second, certain medicines, anti-epileptics. Now, these are the medicines which are used to treat fits or seizures. Antacids, these are so commonly popped in pills. Certain birth control pills, anti-anxiety drugs, antidepressants. Hypothyroidism also can cause nipple discharge. PCOS, which is polycystic ovarian syndrome, can also cause women to have nipple discharge. Tumors of pituitary gland, it is called pituitary microadenoma. So these are the tumors which produce high levels of prolactin, and they can be treated by medicines only most of the cases. Chronic kidney disease, nerve damage to the chest from the injury or some kind of a surgery, spinal cord injury, excessive stress, excessive sleep, dehydration, sexual intercourse, seizures, excessive intake of anise or fenugreek. So anise is moti saunf and fenugreek is methi. Marijuana intake, excessive exercise. So all these factors also can cause a milky discharge from the breast when a woman is actually not pregnant or breastfeeding. Now let's talk about non-milky discharge. The nipple discharge could come in various colors or textures. It could be thick, thin, sticky. The discharge could come out from just one nipple or both the nipples. It can leak out on its own, or it could be seen only when you squeeze the nipple. The color of the non-milky breast discharge can give us some clues about the cause, but these are only suggestions. You should definitely see a doctor for a proper diagnosis if you notice nipple discharge of any color. I repeat, any color. So a white, cloudy, yellowish or pus-like discharge could be sign of an infection of the breast or nipple, while a green discharge could be sign of cysts in the breast. A brown, thick, cheese-like discharge could be sign of blocked milk ducts. It's mammary duct ectasia. Clear, yellowish-green discharge could be seen in fibrocystic disease of the breast. A clear, absolutely clear discharge could be sign of a papilloma. So what is papilloma? It's a benign growth in the mammary ducts. Or sometimes a clear discharge could also be sign of a breast cancer. A blood-stained discharge, we definitely need to rule out the breast cancer. In addition to the discharge, you should also be watchful of some other associated symptoms, like a lump or swelling in the breast or around the nipple, any breast pain or any tenderness, nipple changes like the nipple turning inwards, any dimpling, change in the color of the nipple, itching or skin changes like rashes or some lesions over the nipple, redness, breast size changes such as one breast which is larger or smaller than the others. What is the connection between nipple discharge and breast cancer? I know everyone is worried about breast cancer when they see nipple discharge. But most of the times, nipple discharge is either normal or caused by a benign medical condition. But if the discharge is bloody or clear or from one breast, occurs spontaneously, continuously, without any stimulation, and is associated with breast lump or any abnormal changes in the breast, a thorough evaluation is needed. Actually, nipple discharge of any color needs an evaluation from the doctor. So what to do if you notice any discharge from the breast? Number 1, do not panic. In all probability, it's a benign condition and it's easily treatable. Second, seek an appointment with a doctor. Third, get your medicines reviewed by a doctor. By merely simply stopping these medicines can sometimes cure your condition. Get yourselves the required investigations. The doctors like to order blood work like a thyroid profile and a serum prolactin. The doctor might also order the cytology of the discharge, basically to look for any abnormal cells there. And an ultrasound of the breast or a mammogram also might be ordered. And in suspicious cases, we might even ask for a biopsy in case we find any lump or a lesion there. In case your serum prolactin levels are high, the doctor might ask for an MRI of the brain to look for any tumor in the pituitary gland. So, panic is never the answer. A thorough, methodical approach to diagnose the condition and then a proper treatment will easily solve the issue. So today, if you found this video useful and reassuring, do not forget to like, share and subscribe to Maitri, and I will see you soon.